Hi everybody, welcome. For each topic, I'll be asking you to view these short video clips like this one, where I summarize the big takeaways, that is, the critical elements of the lesson that you just absolutely have to know. Call them the big takeaways. This often involves pulling together some big ideas, sometimes across multiple chapters, to help you see a bigger picture of mental health and our chosen treatment interventions. So please watch these videos in each module coming up. The big takeaways from Chapter 1 on abnormal behavior are these. There's 3 of them. Number 1, we detect abnormality by considering the criteria used to determine abnormal behavior. And those are the 3 Ds: deviance, discomfort, and dysfunction. Now, deviance is always present. Notice that from the readings. This is why we often notice a unique behavior in the first place. One other D, discomfort or dysfunction, is usually enough for a diagnosis of abnormality. We refer to it as deviance plus 1. Deviance plus one of the others, discomfort or dysfunction. So for example, imagine a person who genuinely believes that the governor of Texas is the devil himself, truly believes this, but he only complains, he tells others, wishes somebody would do something about it. Deviance in thought is present, right? But he's not deeply distressed by this. He complains some. He does nothing about it, nothing dysfunctional. Now change this example a little bit. What if this same man decides to murder the person he believes is the devil? He's planning to murder the governor of Texas because he believes this will secure himself a place in heaven at the right hand of God. So he plans to assassinate the governor of Texas. Okay, now we have a problem because he has now become dysfunctional. He's about to break the law, about to murder someone. Now we have a diagnosable disorder. Notice deviance in thought by itself is okay. Deviance plus one of the others, in this case dysfunction, is not okay. That's now a diagnosable disorder. Surely there are conditions where all 3 criteria are met. Imagine a depression, the deeply sad person with constant sad thoughts and low mood. That's deviance. Who's miserable because of it. That's distress. And who cannot work or care for her family. That's dysfunction. Deviance plus both of the others in that case. It can exist, both distress and dysfunction. Remember that if it does not meet the criteria used to determine abnormal behaviors, the 3 Ds, it actually qualifies as normal. We call it normal, meaning what we call normal can sometimes look very strange, very deviant, even quite bizarre. Without the distress and without the dysfunction, it's okay. It's considered normal. People can be pretty deviant because deviance alone is simply not enough to diagnose because it does not meet our criteria for abnormal. Deviance plus 1. The second big takeaway, remember that normal and abnormal are actually on the same continuum of human experience. Abnormal is just of greater intensity or greater duration. Thoughts, feelings, behaviors, whatever it may be. But we recognize these thoughts, feelings, and perceptions in their mild forms as part of normal experience. It's the extremes that draw our attention, right? The last point, the last big takeaway, I ask you to guard against what's called the medical student syndrome. Oftentimes we can empathize with the difficulties manifested in these symptoms of mental illness that we're studying. Now this can easily turn into wondering if I have the disorder that I'm reading about. Now this can really sneak up on you, seriously, so I'm not kidding around here. You have to remember that a disorder is in the extreme condition. It's unlikely that you experienced or are experiencing a disorder without some serious disruption in your life, serious distress or dysfunction. We can acknowledge, and often do, our occasional nearness to a clinical syndrome. That is, we can see the continuum between us, depression, anxiety, and the patients. That's not uncommon. So to summarize the big takeaways from Chapter 1, number 1, we detect abnormality by considering the criteria used to determine abnormal behaviors, and that's the 3 Ds: deviance, distress, and dysfunction. Anything not meeting the criteria, deviance plus 1 more, is normal, not abnormal. Remember that normal and abnormal are on the same continuum of human experience. Abnormal is just of greater intensity, greater duration. And lastly, watch out for the medical student syndrome, thinking you may have one of those disorders that we're talking about. Experiencing difficulties doesn't mean you have or had the disorder. Those are the big takeaways from Chapter 1 on abnormal behavior. Thank you, everybody.